So when do you know you need to do something when you're having back pain? Back pain is one of the biggest problems that affect people throughout the world. And it's one of the largest problems that causes healthcare costs and loss of income. So today we're going to talk about it. I've got my brother, the nurse practitioner, who's been working with patients for 30 plus years to help us discuss that. And he's someone who's actually had a back surgery in the past. So, welcome, my brother Noel. I can't wait to talk to you about this. I'm very excited to talk about chronic low back pain because this is something that so many people suffer from. And I would love for us to talk about the pain that we can see and the pain that we really can't see, we don't understand when we go to the doctor and they really don't see anything that's wrong. So tell me, what should we start thinking about when we're thinking about, do I have a problem with my back?
You notice it's
Yeah,
kind of subtle,
I just
and you notice
or
I can't
was
lean over and
or
do something like I normally did because that posture causes muscle
yeah,
spasms. Or you wake up in the morning and you have a horrible
oh,
pain in the hip or back area that's worse than yesterday, and it feels like the muscles are spasming. Usually it's very
And
slow.
if you stretch or something, it doesn't go away or it
No,
does go
no,
away.
it makes it worse sometimes.
Oh, wow. Okay. So, and you don't really know why it
Well, you
happens.
take usually some over-the-counter medicines like ibuprofen or Tylenol or Deadman or something, and the pain kind of subsides. And then you go on about your business, doing bad body mechanics and posture and so on. And then it comes back about 3 days later, and you're like, why does this keep coming back? And it gets
Oh,
bad
shoot.
enough to the point where you go see your doctor. And the
Well, let me
doc,
ask you something. Should you wait to the point where it gets so bad that you're feeling numbness in your legs or your feet or you're having any of those kinds of problems? Do you have to wait that long or should you go earlier?
well, I made the mistake of waiting because mine would come and go, but mine, I ignored mine for a little while because
Oh,
mine was painful. But if I sat down, the pain went away. If I used
well,
a cart in the grocery store, the pain went away. If I had anything to support me, the pain went away because it opened the spinal canal.
um,
So I put it off for a while.
really? And do you regret that or do you wish you had done something earlier? Or is it hard to even think
It was
about?
really hard to accept because the thought of back surgery is so severe and they want you to exhaust everything before you do back surgery. Everything. They
Mhm.
want you to exhaust physical therapy, acupuncture, psychotherapy, but pain therapy. They want you to
Really?
exhaust everything
Really?
because, yeah, one of the things that people don't do is change their pillow, change their mattress,
Yeah.
change their
Yeah.
car seat, and they don't do
Yes.
that. But I did that. So, and it did get better for a short period of time.
A lot of people, I mean, some people, they'll start physical therapy and they think, why am I doing this? And then they stop and they don't do the 6 to 12 weeks of physical therapy. And because they don't really notice a change or they feel the exercises are stupid or something. How much physical therapy do you think you had to go to?
Probably about 3 months. But before I even had surgery, one of the physicians I worked with, he said, change your shoes. And he actually
Really?
purchased like 5 pairs of different shoes and he
Oh,
would
wow.
alternate them. And he made sure they gave him the lumbar support and the support that he needed. And he said, when you use the same shoes every day after day after day, the support wears out. And he said, most people don't have good supportive shoes. He said, invest in a little expensive shoe or two
I'll be
and
darned.
alternate them.
So do you think going to a podiatrist would help?
I think that if you know what your foot needs or know what your back needs, because you need a decent arch support, but you need support like
Mhm.
in the shoe that's going, if you're on your feet all day long, you need to have a support cushion more than just, what are those shoes called? Those slip in shoes, more than that,
Orthotic.
those memory foam, because
Yeah.
those wear out. It has to be really, really durable. It has to really be
Yeah.
long lasting. And once
Right.
I
And
did that, my pain got better too.
oh, wow. So
So it
you
kept pulling me.
oh, I'll be darned. And I think that's what the problem is with back pain. It's not something that's always present. It's on and off, on and off. And I think, how much did you realize that you needed to do something about your posture and exercising and strengthening your core?
Probably when it's too late because by the time I got to the really good neurosurgeon, it was pretty bad. I couldn't even stand up for like a minute, but
Oh,
I
wow.
was not in horrible pain. But definitely, I was limited to what I could do and not do because I couldn't stand
Wow.
up very long.
Wow. So it was really impacting your
My life,
work
yeah,
and
and
everything, your
and
quality of
and
life.
my
That's
recovery was very good. The one thing I couldn't do after recovery was he said you can't do any BLT, bending, leaning, twisting. I couldn't twist. I
okay.
couldn't bend. I
No
couldn't
bending,
lean.
no
He said
leaning.
BLT, no
Okay.
BLT. And I couldn't do that for like 6 months.
Now, have you felt like you can do it
Oh
now,
yeah.
bending?
After fusions, osteophyte, and they heal, he said, now you can bend and stoop and lift. But he said, I don't want you lifting anything over 20 pounds.
Wow. And you had to do that for 6 months.
I still watch what I lift now, and it
Really?
changes your life because you are so protective of your back. It's like I don't move furniture now. I don't lift patients
Really?
now. I do
Yeah.
very limited lifting. If anybody else is there to lift, I make them lift.
Yeah.
The
Because
biggest
it does
problem I have is
just injury.
said, yeah, I'm afraid of re-injury. I have a fear going down on one knee.
Really?
I don't know why. I think it's because I want something to hold on to.
Yeah, because I think everyone realizes that if I have something to help me kind of stabilize myself going down or coming up, I'm not putting all the pressure on my spine or on my back or on my joints in general. And then when you went to several,
I went
back
to a
doctors.
local neurosurgeon in where I live, and then I was not very happy with them. I didn't like their recovery. Wanted to send you home the same day. And then I
What?
went to, can I say where I went to?
Yeah, you went to Emory.
I went to Emory, their spine and orthopedic clinic.
The best in the country.
Yes, it's all Dr. Ree.
And they train
He
so
works
many.
on scoliosis and spinal
Yeah.
stenosis.
I mean, they train a lot of physicians for neurosurgery, and they are amazing. And did you ever see a physiatrist for just discomfort or any kind of injection help
No,
you
I
with the?
really, after surgery, there were other complications. Like I couldn't get the pulley catheter out. So that was actually more
Yeah.
problematic. And after
Yeah.
that came out, it was like trying to find comfortable space in the bed
Mm.
or in a chair
Yeah.
because you want to get in a comfortable place where you can relax. It's just like you can't find it. It's feel horrible because I made my sister change all these chairs and things multiple times to get a comfortable chair.
Well, part of the problem is you've had surgery on your back. You know, there's an incision there. And that means that they've cut through muscles and tissues that are now trying to heal. And that takes time. And some people call it pain, some people call it discomfort. This is something we totally know about surgeries, that there can be this kind of long lasting discomfort that's present that will take a while to heal. I'm not surprised that you had trouble,
Well,
finding
you
comfortable
also want to
position.
be in your best physical condition before you go to surgery. And sometimes the surgeon said, I can't operate on you now because you're 20 or 40 pounds overweight and that you're too high risk.
Yeah, that happens a lot. And I think that's a big challenge. And so people end up suffering. I think it's a lot of things we don't understand is what the impact of sitting and collapsing or whole posture down, or we're overarching or overextending because we're looking at cell phones all day long.
Right.
So we're not doing the things that we need to
Here's the
do
catch
to
22.
really.
Your doctor says you need to be more active and lose weight. And you can't because you're
Yeah,
hurting.
I know. You need to two-step in place.
Right.
So,
It's it.
how long do you think you had to deal with it to make it something that you got a final
I actually spent
reaction?
2 years
Mhm.
before I had surgery
And do you
because
feel like sometimes the process is a long period of time because you need to
you
go
want to make
through
sure you exhaust everything because something may work. And there's some things that work a little
it?
bit and don't work a lot. So
He had bad sciatica, and he would do the shots, and the shots helped him. Those helped him a lot.
but you can only do
Yeah.
so
Yeah.
many,
I
and
know.
they're not cheap.
No, they're not. Typically, you'll have a shot, it'll help you for a little while, and then 3 months later, you need another one. So sometimes it's hard for you to get some of recovery. So what do you feel like you were surprised the most by now that you're how many years out after surgery?
I want to say 6.
Yeah,
And actually, I got a call from the physician about 4 years out, and he said, "How are you doing?" I said, "Great." He said, "Well, you made it past the 80% mark." I said, "What does that mean?" He said, "Well, 50% of the people have a relapse or have spinal stenosis comes back." And he said,
yeah,
"Yours hasn't at all." I said, "No." He said, "What did you do differently?" I said, "Well, I have been very protective of my back. I've tried to lose weight as best I can, and I did. And I said, I did try to get my abdomen stronger and
right.
getting your quads and your abdomen stronger is helping. And then I changed my mattress and pillowcases. I
See,
mean,
to
pillowcases,
me,
pillows.
all of it's done a lot. And then what are you doing about posture during the day when you're sitting for periods of time? Are you using supportive stuff?
Yeah, in my car, I have like a specific way the seat sits. In this chair, it sits so that I can sit back or sit up straight and has nice armrests. And the chair at work is the same thing because I sit several hours at work. I have to get up
It's
and stretch
work.
and
Yep.
make sure.
So do you feel like it was quite worth it
Oh,
now?
yeah, yeah. I got to a point where I was driving that electronic little motor scooter at the grocery store because I couldn't push the
Oh,
or yeah, it was bad. Alright.
yeah, I know, I know. And do you feel like the transition from the 6 months to 1 year, then a 2 year, do you feel like anything you still kind of lingers since the surgery?
Well, yeah, a little bit because I think I have arthritis and I still take ibuprofen once or twice a day, and I would really like not to take it at all. But if I don't sleep well.
Oh, because you have some discomfort still?
I end up getting out of the bed after a couple hours, getting in the recliner for about 2 hours, then getting back in the bed because my back is aching.
Yeah.
And it's aching.
It's because there's still some kind of lateness, huh?
If I
So
lay
do you
too flat too long, it starts aching.
uh, that's sometimes maybe supportive pillow in the
Yeah.
bed, that types of things can help you. Do you think being a clinician helped you manage this a little bit better?
I think it helped me pick the right neurosurgeon or orthopedic surgeon, yes.
I think that
Worked in every and I trust them and now very much. And they're a center of
yeah,
excellence, so
I know. I think that's the way you and I both feel because we worked in centers of excellence a lot. And we really understand that, when you have people who teach other doctors every day, there's a sense of understanding that they have that they're able to manage unexpected things that happen because they may have seen it before. You know
one
what
of
I
my
mean?
patients had the same surgery the same time I had it. And unfortunately, he got an infection at the surgical site.
Oh
He
no.
got a staph infection there. They had to
Oh
go in
dear.
and reoperate. It got so bad, they had to send him down to Shands and do a whole new spinal surgery to get rid of the bacteria.
Oh
So
dear.
that's why it's so important to pick the right center.
Yeah, it really is. And even at large centers, you still can have those kinds of things happen. I remember when I was in recovery from my hip surgery, one of the patients that was in the room, they had an infection on their knee replacement and it was a real struggle. And I think sometimes it's the thing is that we don't notice that there's an infection
Well, what
until
was
it's
really
too late.
sometimes the surgeon doesn't tell you, okay, what is the sequence of events that are going to happen? That's important to know because
Yeah.
in mine, when Emory handed me their thing, it said, you'll be admitted, you will stay a day or so until you are cleared by physical therapy to leave. And my patient who had the same type of surgery, I had the exact same problem. He was discharged that same night. And his wife told me that he was discharged at 11 o'clock. She took him home and she was by herself. And she said at 2 o'clock in the morning, it was in agony. And she was calling a person on call that didn't even know his history. So I said, well,
It's
that's important to know
correct.
whether or not they're going to admit you.
Yeah, that to me is strange. I have to tell
Well, if
you,
I had had my surgery locally, that would have happened too. They would have sent me home that same day.
and see, I don't agree with that. I don't agree with that in major surgery. Unless it's something nominal, But even someone else that I know who had, I think, a laminectomy, they wanted to send her home the same day too. And she said, no, I don't want to. I want to stay here until I feel like I can go home and feel safe. And I think that sometimes, I mean, I know that if a patient doesn't feel safe going home, and I think that's part of it. I mean, I was thinking about my hip replacement, and I wish I had said something to the physical therapist when he had said, let's try and walk up this incline when I ended up breaking my femur. I wish I had gone with my own instinct and said, no, I feel like that's a little too much. But sometimes we don't feel like we have the right to ask or say what we're feeling.
Yeah. Because they
Because
know more medically. The other thing
exactly.
that happens after surgery is sometimes you have to really have a support team. They have to know body mechanics. They actually have to wipe your ass for the first couple of weeks after surgery because you
No,
can't do it.
can't bend
Can't
and
reach back
turn
there.
around and do it.
Yeah. He doesn't
No,
want you twisting.
no twisting, none of that. And so you really do need
For like
help.
2 weeks.
Recovery, like 2 weeks, really. And then when you feel like you really could start being more independent.
Probably 6 months.
Wow.
I mean, when it really, the wiping my butt, I felt like after the first month,
Okay.
I still wasn't, to cautiously getting out of the chair, getting in the car, in and out of the car. That's stuff that I was still really cautious
Do you still think about it now today?
a little bit. Because there was
What
one
if
time
there?
after surgery, I was driving and I looked back and I twisted and it hurt so bad. I said, oh, maybe it's too
Oh
soon to
no.
twist. I never did it again.
Yeah. So you really are conscious about practicing certain things that you do protect your back.
And then do simple
So
things
it's
like
really
find out
true.
how many things you can do to make the back pain better and exhaust everyone. Change your chairs, change your posture, change your bed, change your mattress, change your pillows, change
Use
your shoes.
support. Mhm.
And some people can't afford all that. So do one little thing
No,
at a
that's
time.
part. And you may not be able to afford a few things all at once, right? So
It is not cheap.
yeah, that's true. So is there anything you wish you had known before you start this whole process to find you needed to back surgery?
I think I wish I would have had a different person in the hospital with me, I think. Because I had my
What?
mother, and I don't think she knew anything about body mechanics and she's old and
Yeah.
couldn't have had her there in the beginning. And it was during COVID time.
I know that was pretty. And also too, I think when sometimes you have MRIs, if you're an older person, sometimes an MRI doesn't look normal. It'll be abnormal, but a lot of it is because of aging, right?
Yeah.
So it's hard to make a decision, especially if you don't have something distinctly like, oh, this is a bulging disc, or oh, this is definitely like the narrowing of the canal. So those are
even osteopenia can or eight, and that's before it becomes osteoporosis.
Yeah. So those kinds of things can show up, and it's helpful to know that even though you have an abnormal MRI, it's not the end of the world. So I think, again, it sounds like it's about finding a good clinical team that you feel confident with. It's about really exploring all options for back pain, over the counter, patches, rubs, topicals, NSAIDs, all of those things are helpful. And then physical therapy. Don't give up on physical therapy.
Some people even find acupuncture.
Well, I love my acupuncturist. She helps me with my knees, and I have this terrible arthritis in my fingers. My hands don't hurt because of the acupuncture, and yet you can tell I have terrible arthritis in my fingers because they have that big bony, whatever that is, the kind of distortion of the joint. Yet no pain. And she gives me a treatment once a month. I really believe in some acupuncture. And if you don't do acupuncture, you can do acupressure. If you can't afford it, there's definitely good things to come from acupressure. And there's also pressure points on your face as well that you can access. So, if you had one thing that you would recommend for people to think about when they're considering what to do about their pain, what would you suggest
About their pain,
about their pain
I
and
would
discomfort?
say not to take too many over-the-counter NSAIDs.
Really? So maybe rely on topicals a little more?
Well, I think our body has its own endorphins and pain relieving neurotransmitters. And I think I was taking too much over the counter meds and I could feel them wear off. And
Oh,
instead of
wow.
waiting for my bodies to kick in, I would take some more.
Oh, wow. Hmm. Well,
But I didn't want to take any narcotics.
they're not going to give you any.
I didn't
That's
want
the
any.
problem.
Yeah.
The normal pain regimen is only those things that are over the counter and physical therapy. There's very rarely a circumstance, unless they see something critically wrong, like, a herniated disc, where they're going to give you something stronger than over the counter or NSAIDs, that you're not going to get access to those things. You might be able to get something like a muscle relaxer
Yeah.
or those types of things. And it's very difficult to get an opiate or anything more intense, strong than that. So, well, I'm so appreciative for you joining me here. It's wonderful to talk about chronic low back pain where we know so many people suffer with it. And I think, so, and we don't feel empowered to take steps for being proactive for
Yeah.
our own health care.
Get your
And we
stomach in
don't,
shape. So
yeah,
get your
and we
core in
don't,
shape.
well, exercise and weight loss. I know for me, doing these things that are exercises that are simple exercises and losing 55 pounds, I think that made a big, big difference. And I'm still trying to lose a little more weight because really we want to make our bodies as healthy as they can be
And last
to
as
help
long.
ourselves and to have function for as long as we can, right?
Yep.
Well, this is MC of Healthy by George. I hope you appreciated this message about chronic low back pain and you'll share and like and join and subscribe. We'd love to see you here. My brother Noel, I'm so grateful for your help
Welcome.
and
Thank you
joining
for
me
inviting
today.
me.
I love when you join talk about all the shared experiences, both yourself and a patient.
Have a good evening.
Talk soon. Bye. So thank you so much for joining me at Healthy by George. I hope you found the information inspiring and that it encourages you on your wellness journey. Because remember, your body, your well-being are a most precious gift, and every tiny action taken daily can make a huge difference. I hope the information here is educational purposes and is not meant to replace your medical care. See your doctor and talk about what works for you. If you enjoyed today's content, don't forget to give it a thumbs up and subscribe to my channel. Your support means the world to me, and it helps me continuing creating content that inspires and empowers you to live your best life. Goodbye for now, and join me again at the next Healthy by George.